Hi all, my name is Dr. Tony Feher and I'm here with the Indiana Orthopedic Institute to talk a little bit about what I tell patients after surgery. So I replace hips and knees, and so a lot of times I'm coming out to anxious family members who want to know how it went, and they want to know how to make sure they take care of their loved ones well after surgery to guarantee their best outcomes. And so this is what I tell everybody. Most patients will have an ACE wrap around their leg to help cut down on that swelling. That ACE wrap can come off within uh, 12 to 24 hours. Take it off that night, or if you want to have it on till you get home the next day, that's okay too. Underneath that ACE wrap will be a bandage. It looks like a giant band-aid. It's waterproof, so you can shower the next day. Just don't submerge it in anything, just in the shower. Getting it wet is okay. That bandage should stay pretty firm. If it starts to feel like a water balloon, like squishy underneath it, then it needs to come off because either water got in it or water leaked out of the incision a little bit, which is common, not that big of a deal, but we can't leave that water on there for any length of time. So you just take it off. If you've had your knee replaced, just put some gauze, an ACE wrap around your knee. If you've had a hip replaced, it's harder to put an ACE wrap around it, so just gauze and tape can be quite helpful. Um, and so then as far as swelling goes, ice, 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 ice. You want to ice as much as you can, at least 30 minutes every hour you're awake. You can put a barrier between the ice and your skin if it's too cold, but you want to keep it cold. Uh, some folks have a ice cooler that circulates cold water through a brace that goes on your leg. If you have that, that's great. I recommend you use water bottles that you freeze in the freezer and then rotate them through and just supplement it with ice. Otherwise, you're going to be chewing a bunch of ice through that and it'll melt like crazy and you'll be spending all kinds of money and taking up all kinds of freezer space. So otherwise, if you don't need that. But if you don't have it, then I recommend gel packs. They're formable. They can be whatever size you find, and they work really well for hips and for knees. The big thing is just at least 30 minutes every hour you're awake. Because we want you to be keeping that cold. The other thing is elevation. We want that leg elevated, your foot elevated above the level of your heart. So to do that, you got to be on a couch or in your bed with some pillows underneath your leg to elevate it. That's important even if it's a hip because your whole leg can get swollen. So we want you to keep that foot up to keep that swelling down. If you've had your knee replaced, it's important to remember not to put a pillow right behind your knee and only your knee because then it'll keep that knee bent a little bit. And when you get up, it'll be really stiff and it's hard to get that extension back. So if you've had your knee, get something up underneath that heel to keep that leg up and elevated. That's another reason why we recommend against using a recliner for the first few weeks after surgery because it's really hard to get that leg elevated above the level of your heart. If you've had your hip replaced, it's also harder to get up out of that chair because your tushy sits so far back in it. So pushing yourself up is tough. So try to avoid those recliners. The other thing, after any kind of joint replacement, especially hips, but knees as well, you can have a lot of blood pressure fluctuations. So we want you to be careful when you first get up, especially the first 24 to 48 hours. So when you get up, sit on the side of the couch or your bed or the toilet for at least 30 seconds to a minute before you get up, then stand up, hold on to that walker, and stand there for 30 seconds to a minute before you take another step. Because sometimes you get that when you stand up too fast, everything gets real dark and closes in on you. That can happen if your blood pressure doesn't come up and you don't get blood to your brain fast enough. So you just take your time and you'll be okay. And so the other part of that is take your time, use your walker. Your leg, whichever leg was operated on, will be quite weak. You want to make sure you have something to hold on to and make sure that you have somebody close by for the first 24 to 48 hours whenever you get up and get walking. We just don't want you to stumble or fall or kind of get into a spot where you don't feel safe. For hip replacements, I tell folks I do an anterior hip replacement for the vast majority of what I do. Those hip flexors can get really, really sore. So getting in and out of bed, lifting that leg can be quite difficult, especially when all the pain medicine wears off. And so don't be worried if that happens. It's quite common, and that can last for 4 to 6 weeks too. So talked about pain a little bit. We give you a lot of medications prior to surgery and during surgery, multimodal pain control, anti-inflammatories, Tylenol, narcotic pain medicine, spinals, blocks. We do a lot of stuff during surgery to make sure that you're able to get up and move quite quickly and to control your pain. A lot of that stuff will wear off around 1, 2 in the morning. And so we want you to be prepared for that. One, we don't want you to be worried. We also don't want to get to that point, because if we got to that point, it's hard to come back once you're behind on your pain. So if you haven't taken a pain pill before you go to bed that first night, take at least a half of one. A whole one if you're not getting too nauseous or it's not making you too loopy. But don't get behind on your pain. It's just really hard to catch up. Those are the main things I tell folks. The first few weeks after any hip or knee replacement are going to be tough, knees especially. You got to keep it up, keep it elevated, keep ice on it, keep moving. That's the important part. Walk, 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 get up, get moving, do it safely, have somebody close by. And first and foremost, just congratulations on making a great decision to get your hip or knee fixed. I know you've been miserable for likely years, and the next few weeks will be tough, but once you're through it, you're going to be able to do things that you haven't been able to do in years. You're going to be able to spend more time with your family. You're going to be able to get back on the pickleball court. You're going to be able to get back on the walking paths. And we are honored, myself and my staff here at the Indiana Orthopedic Institute, that you've chosen us to help you with that journey. And as always, if you ever have any questions or concerns about anything, please call the office. We want to know about things. We don't think there are any dumb questions, no stupid questions, no inconveniencing us. This is what we do. All we do is hip and knee replacements. We're good at it. Our staff is prepared to answer your questions, so never feel like you're putting anybody out when you call to answer a question. So thank you for your time. Look forward to working with you in the future. Thanks so much. Bye.